the patient's vital functions have already ceased. We're checking for the patient's pulse. And we're checking also for the patient's respiration. Now we're going to notify the physician about the records, and then we're going to record the patient's time of death and the patient's pronounced time of death.
Time of death, 10:30 p.m.
Noted, Doc. So after the patient was pronounced dead, we're going to inform for the department and for the patient's loved ones. Especially, we're going to inform the attending physician, the nurse supervisor, the medical examiner, the census organization, the emergency contact person, and the appropriate agency for organ procurement. Sir Head Nurse, Sir Supervisor, our patient from room 208, Ms. Montes, has already passed away last 10:30 p.m. Excuse me, sir. Kayo po ba yung family ni Ms. Rachel Montes? So, gusto ko lang po sanang i-inform sa inyo na wala na po siya last 10:30 p.m. It was pronounced by the doctor na pronounced dead na po siya and hindi na po gumagana yung vital functions niya. I'm so sorry for your loss. Hi sir, ask ko lang po kung meron po ba kayong special request, especially sa inyong religious or cultural beliefs sa ating patient?
Kung pwede po sana huwag na siyang idaan sa autopsy.
Okay po. So, hindi na po namin siya dadaan sa autopsy. Noted, sir. Thank you po. And condolence again. If there are any patients together with the patient who is already dead, we're going to offer for the patient to transfer in another room. Excuse me, sir. So, your roommate has already passed last 10:30 p.m. So, we're going to offer you to transfer to another room. Is it okay with you, sir? Thank you, sir. So, we're going to do the transferring right away, sir. Now, we're going to wash our hands and gather all of the equipments. The dry cotton balls, the face towel, the basin or the kidney basin, the gowns, the Lysol 2% solution, the road gauze, the 3 identification tags, and the morgue sheet. Place a no visitor sign. Check the nurse's station at the client's door. We're going to put the body in a supine position in a flat bed and wear clean gloves. Now we're going to elevate the patient's head using 1 to 2 pillows. I will only use 1 pillow. Now we're going to fully close the patient's eyes by applying gentle pressure. If the patient's eyes is hard to close, you can use the cotton balls, wet them, and then place it on top of the eyelids to avoid them from being open or from keeping on opening. Now we're going to remove the patient's jewelries and possessions. after taking off all of the patient's jewelries, we're going to take a list of her jewelries and possessions, and then we're going to give it to the patient's relatives or to the head nurse. Now we're going to clean the patient's face with a damp cloth. And then replace the patient's dentures. Now we're going to put a small towel on the patient's chin if the mouth keeps on opening, or a long gauze to tie it from the chin to the head. Now we're going to remove the IVs and the tubes connected to the patient unless autopsy is to take place. But as for the patient's relative request, they requested not to perform an autopsy, so we're going to remove the IVs and the tubes that are connected to the patient. Suppose I've already removed the IVs and the tubes that are connected to the patient, we're going to remove the patient's gown, the patient's soiled gown. After that, we're going to remove adhesive marks with either gasoline, but we're going to perform that after bathing the client with the 2% Lysol solution. Now we're going to bath the patient with 2% Lysol. After bathing the client with 2% Lysol, we're going to pack the patient's rectum and vagina with cotton if indicated and if there are presence of discharge. Remove and discard used gloves and then wear a new set of gloves. Suppose I've already disposed my gloves and wear a new one, we're going to put on the lab gown to the patient. Cross the patient's arm onto her chest. And to keep it in position, we're going to use the gauze. Now we're going to tie around the patient's wrist her identification tag. If the body is to be viewed, we're going to replace the patient's top linens. Replace the tidy unit and place a morgue sheet under the patient. After that, we're going to transport the body of the client to the morgue, or we're going to wait for the arrival of the mortician. Now we're going to put away used equipments and supplies. After that, we're going to wash our hands. Now we are going to evaluate using the following criteria. The body is cared for and transported appropriately. After that, all necessary notifications are carried out. Family was able to carry out virtual viewings and spend time with the patient as desired. Possession handled appropriately. And then document post-mortem activities including the time of sensation of vital signs, person notified and time of notification, list and disposition of valuables and personal effects, time body removed from unit, destination, and by whom removed, and other information required by the facility.